agreement of how the LHIN can partner with the First Nations in the community around planning for services and impact the First Nation communities. It sets up the membership and how those members can report back to the councils and to our board. So it's a formal entity that has staff from the First Nations and our staff identifying priorities for the First Nation community, and then we bring those back to our councils and our boards for endorsement, and then we move forward. Background, all LHINs are actually required to engage the First Nation peoples and Aboriginal persons in general. So the best way to do that for us was establishing a health advisory circle that had the endorsements of the communities that were involved. Because, it's great that people get together, but we really need to know that we had the council's support, we had our board's support in the work that we were going to do.
It's been a long process. I think myself, I got involved after 2 years. I think it's been going on with about 4. But our biggest obstacle being First Nations is not convincing, but getting the other groups to understand that we need 2 separate terms of reference. First Nations, we got land base, we have buildings, we have staff, and so they finally came to the understanding. It's probably the best, their terms of reference is the Métis, the friendship centers, the urban. So, that's fine. So they can work out,
right,
their problems, but our bands, we can work together.
As an agency of government are here to really engage our communities, and some of our communities are different. They're not just Peterborough versus Cobourg or Toronto. It's our Aboriginal communities, it's our Francophone communities, and there's a history here in our region that the First Nation mark is much stronger than one would first think. And so this is a mechanism of us knowing the community, and really you cannot create healthcare solutions for people without asking them how to best do it and what the problems are. And First Nation people really feel that they need to be in front of the solutions and to be in front of the creativity, the planning, rather than us doing it for them. So this is really what community engagement is about.
Northumberland Hills Hospital is in our jurisdiction, and then Peterborough, would cover Hiawatha and Curve Lake. I don't know who's Scugog, probably Oshawa, so, we all have our own little regions also. So. But that'll just give us a voice if they're closing some departments, we hear shortage of beds, and so maybe when we get to our main table, we can ask why.
It's a voice for them, but it's more than a voice. It's a way of actually sharing the challenges. When we are looking at diabetes as a significant problem in our area, we have no way of knowing how to best reach elders, the youth, the people at risk, and really it's working through the elders, the people that are respected in these communities, that we're going to best reach out to those people who could benefit from these services. And not our services aren't necessarily what's best for them. So it's really an act of translation. How do we make what we need to achieve together as a community with good health? How do we do it through the lens and the knowledge of this community? And that's what we're trying to do. LHINs weren't created just to go and say, everyone do what the LHIN told you to do. So we actually have to learn from our communities. We have to make the healthcare system work for them. And it's very challenging to do that for First Nations because there's such a history here that until you dive deep into it, you don't really know enough about it. That's my experience anyway.
Hey,